My name is Bryce Arsenault, and my speech is on ACL tears, causes, and prevention. To start this speech off, let's talk about Derrick Rose, who was an NBA point guard for the Chicago Bulls back in 2012. And in their first playoff game against the Philadelphia 76ers, Rose went up for a shot and landed awkwardly on his left leg, which resulted in an ACL tear and cost the Bulls the rest of their championship season. This injury is important to me because as a guy who's played soccer all his life and now works as a physical therapy technician, I've seen this injury in person too many times and know the recovery process well enough to know that this is a very serious injury. No matter if you're young, old, male, female, athlete, or not athlete, this injury does not discriminate. So this speech is designed to educate people on some causes and symptoms of this injury and some risk factors and treatment and prevention options that can help increase or decrease your chances of receiving this type of injury. But first, let's talk about the causes of this injury and the anatomy of the ACL. So first off, what is the ACL? The ACL is this anterior cruciate ligament that connects the femur and the tibia together through the surrounding muscles of the knee. According to an article called Torn ACL Causes, Treatment, and Symptoms, the ACL controls how far the tibia moves beneath the femur, so that's extension. If it moves too fast, too far, that's called hyperextension, the ACL may tear or rupture. So some things that can cause this hyperextension in the knee is things from poor landing from a jump, stopping a run suddenly, a bad collision, and sudden changes in direction. All of these things can create hyperextension in the knee because in all of these things, your body is moving forward, then it comes to a sudden stop, a sudden awkward stop, which can result in hyperextension of the knee. Now that we talked about how an ACL tear is caused, let's talk about some symptoms that one may experience. So some symptoms are a popping sound. Now this popping sound comes from the actual ACL itself tearing apart. That's the sound you're going to hear. Another symptom is knee weakness and instability. So this ACL is designed to keep your knee stable. So when it tears, it becomes very weak and your walking pattern or your gait becomes very unstable and wobbly and weak. The next thing you're going to notice is a lot of swelling and inflammation in the knee due to all the blood rushing from the tear. Now that we've talked about some symptoms, let's talk about some risk factors that increase your chances of receiving an ACL tear. First thing is being female. This is because a female's muscles don't contract with the same force as a male's muscles do. So in males, the ligaments are held tighter because those muscles are contracting with more force. In a female, those ligaments aren't holding on as tight because of the less force when contracting. So that looser connection raises the susceptibility to slips and falls and hyperextension when doing quick, sharp movements. Next thing is wearing loose footwear. Loose footwear creates instability in the foot and the knee. So whenever you miss a step on the stairs or even stepping on a rock, wearing loose footwear can slip your leg out of balance and it can create an awkward slip and fall, resulting in hyperextension and an ACL tear. Last thing is being active on artificial grass, especially if you play contact sports, because artificial grass is more slippery and less coarse than real grass. You don't have that same grip as you do on real grass to keep you steady and stable. So artificial grass creates less stability, which results in more susceptibility for slips and falls, which can result in ACL tears. Now that we've talked about risk factors, let's talk about some preventative measures and treatment options to decrease your chances of an ACL tear. First thing is lots and lots of stretching. So you athletes are going to want to train your muscles year round to be able to adapt to different changes in direction. And all of this, even if you're not an athlete, you should be able to train your muscles and ligaments to be able to stretch really, really well so that these muscles can be able to be flexible enough to adapt to the changes in direction in your sport or in your everyday life. Next thing, when you receive this injury initially, besides calling your doctor, the first thing you should do is ice and elevate the knee to reduce swelling and alleviate some of the pain. Next thing you may want to try is landing training. So what this does is you hop around, landing a little awkwardly in each different position to train your ligaments to be able to recognize whenever you have an unexpected fall that and you do landing training, they're already prepared because of those different awkward landing positions you train those ligaments to land in. And last thing is physical therapy. Now, physical therapy is great because these PTs can offer a great program to help stabilize and strengthen all the muscles and ligaments around your knee to help prevent and treat an ACL tear. In conclusion, this injury is very serious and should not be taken lightly. However, as long as you know the symptoms and are able to prevent it and treat it well, you should be well versed around what the ACL is and how you can prevent and treat it should something happen. I'm glad you were able to learn something today. Thanks for listening to my speech.